Hi, my name is David Emerson. I'm a long-term cancer survivor, cancer coach, director of People Beating Cancer. Welcome to the vlog post where I explain cancer coaching, what patients and survivors need to know. Right off the bat, let me go on record. I'm not any sort of medical professional, certainly not an oncologist. I am a long-term cancer survivor who's been studying and writing about cancers, both my specific type of cancer, multiple myeloma, as well as the 20 most common cancers today: breast, prostate, colon, colorectal, lung, etc. In effect, I have learned the patient or the survivor's priorities are aligned, though sometimes slightly different from the conventional oncological perspective. It could be dosing, it could be figuring out side effects, long-term side effects. It could be balancing quality of life and quantity of life. Yes, when we're first diagnosed, we all say we want to beat this thing, though after sustaining months, sometimes years of side effects, cancer patients develop a different perspective on side effects, on therapies, on dosing, on all of those things. I believe I listen to the patient, ask the patient questions, have the patient figure out what's important to them. Certainly, yes, survival, living, that's important. But again, balancing, a good example, evidence-based, non-conventional therapies, those therapies shown to moderate side effects, perhaps help the patient manage side effects. I think that any oncologist will agree that they don't study, as an example, nutrition, exercise, complementary therapies, because that's simply not what the FDA does. That's not what conventional oncology does. Conventional oncology focuses on conventional therapies, FDA-approved chemotherapy, surgery, radiation, extremely important, central, mainstay therapies to fight cancer, though what I've learned over the past 30 plus years is that I think it benefits cancer patients to include evidence-based complementary and integrative therapies. That's what cancer coaching is all about. So if you have any questions or comments, let me know. Scroll down, ask a question, or click the subscribe button to learn more about, again, cancer, complementary, conventional, integrative therapies. Thank you for your time and attention, and hang in there and be well.